Syndrome of Zollinger-Ellison. Zollinger and Ellison first described the Zollinger-Ellison syndrome in 1955. The disease is caused by a tumor in the duodenum and pancreas that secretes a hormone called gastrin. Gastrin causes ulcers in the duodenum and small intestine, which produce abdominal pain and bleeding in addition to diarrhea, and is one of the main symptoms of this illness. Zollinger-Ellison syndrome symptoms. Among the signs and symptoms are nausea, throwing up, loss of weight, diarrhea, abdominal discomfort, severe heartburn, such as those caused by gastroesophageal reflux disease, abdominal bleeding. Zollinger-Ellison syndrome causes and risk factors. A tumor termed a gastrinoma causes Zollinger-Ellison syndrome. The tumors secrete an excessive amount of stomach acid. Excess acid can develop peptic ulcers in the stomach and intestines, which are unpleasant. Zollinger-Ellison syndrome complications. The following are examples of complications. Ulceration causes an abdominal perforation. Reflux due to esophageal stricture. Irritable bowel syndrome. Bleeding in the intestines. Zollinger-Ellison syndrome diagnosis. The following tests and diagnostic procedures can be used to diagnose the disease. We find extremely high levels of the hormone gastrin in blood tests for persons with this condition. Endoscopic sonography, a radioactive scan with somatostatin, and a blood test following secretin injection are used to determine the tumor's location. Magnetic resonance imaging, angiography, tomography, and abdominal ultrasonography are all tests that can detect a malignancy. Zollinger-Ellison syndrome treatment. Surgery is used to remove the tumor, but if the tumor cannot be located or the risks of surgery are too great, Zollinger-Ellison syndrome can be treated with the medicine somatostatin given once a month in addition to treatments that control stomach acid output. Chemotherapy is used in some people when the tumor spreads, and cancers can also be identified in the thyroid and pituitary glands. Zollinger-Ellison syndrome prevention. It is impossible to prevent the sickness.